Dear students, in this video I will teach you about the drug Misprostol. Myself Ruth Kezia, Assistant Professor, Interbellum College of Nursing. Objectives: you will learn on the name of the drug, dosage, route, frequency, mechanism of action, indication, contraindication, adverse effects, precautions and side effects, and nurse's responsibility. The name of the drug is Misprostol, as you see. Next is dosage and frequency. Adult dose, okay, for labor and induction and cervical ripening. The American College of Obstetrician and Gynecology recommends 25 micrograms vaginally every 3 to hours. Some patients may require doses of 50 micrograms every 6 hours. So this is the dosage for labor induction and cervical ripening. Okay, for adult. This misoprostol is also used in case of duodenal and gastric ulcer. For adult dose of duodenal ulcer, it is 200 micrograms orally 4 times a day after meals and at bedtimes. Maintenance dose 100 to 200 micrograms orally 4 times a day. The usual dose, adult dose for gastric ulcer is 200 micrograms orally 4 times a day after meals and bedtime. Maintenance dose is 100 to 200 micrograms orally 4 times a day. So in dosage and frequency, we see that the dosage for cervical ripening and labor induction and the dosage for duodenal and gastric ulcer. The liver first pass effect or hepatic first pass effect is a phenomenon of drug metabolism where the concentration of a orally administered drug is significantly reduced by the liver before it reaches the rest of the body's systemic circulation. So it means before it reaches the blood, a great amount of drug is reduced by the liver. Okay, this process greatly reduces the drug's bioavailability, which is fraction of the drug that reaches systemic circulation in its active form. So only a fraction of drugs only reaches the blood when we are taking the drug through oral, whatever drug it is. But in case of vaginal and sublingual administration, you see it is the drug is kept in the mucosal lining and it is absorbed directly into the blood. So the bioavailability is higher in case of vaginal and sublingual administration. Mechanism of action. In the gastrointestinal tract, stomach, it reduces the gastric acid. And misoprostol directly stimulates the PGE1 receptors on the parietal cells in the stomach, inhibiting adenylate cyclase and suppressing the production of gastric acid. Production of mucosa, it increases the secretion of protective mucus and bicarbonate, which helps to form a protective mucosal bilayer against acid. Mechanism of action, that is increased blood flow. The drug improves the blood flow to the stomach lining, providing more oxygen and nutrients to support mucosal regeneration and repair. In case of preventing non-steroidal anti-inflammatory ulcers, by this mechanism, misoprostol is used to prevent stomach ulcer caused by NSAIDs. Okay, so it reduces the gastric acid, it protects the mucosa, it increases the blood flow, and it prevents NSAID in case this is the mechanism of action in the gastrointestinal tract. In the uterus, what happens? It induces uterine contraction, promotes labor and cervical ripening, reduces postpartum bleeding. It induces uterine contraction. Misoprostol binds to prostaglandin receptors in the smooth muscle cells of the uterine lining, causing uterine contractions. Promotes labor and cervical ripening. This uterotonic effect helps in inducing labor by promoting cervical dilatation and facilitating the expulsion of conception. Reduces postpartum bleeding. The contraction also helps to reduce postpartum hemorrhage after childbirth. In case of gastroenterology, FDA approves the use of misoprostol in case of prevention of non-steroidal anti-inflammatory drug-induced ulcers and treatment of peptic ulcer disease, prevention of NSAID-induced ulcers and treatment of peptic ulcer disease. Misoprostol is prescribed to individuals, particularly those at high risk, such as elderly or those with history of ulcers, who require long-term NSAID therapy for conditions like arthritis. It protects the stomach lining by reducing acid secretion and increasing protective mucus. Treatment of peptic ulcer disease. Some studies also indicate misoprostol's effectiveness in treating chronic peptic ulcers, especially those unresponsive to other treatments. In case of obstetrics and gynecology, the indications of misoprostol are in medical abortion, management of miscarriage, labor induction, postpartum hemorrhage treatment, cervical ripening before gynecological procedures. Medical abortion, misoprostol can be used alone or more effectively in combination with mifepristone to terminate an early pregnancy. Management of miscarriage, it is used to induce the uterus to expel pregnancy tissues in case of incomplete abortion or early pregnancy loss. In labor induction, misoprostol is effective for ripening the cervix and inducing the labor for various indications including postpartum pregnancy, fetal demise or other complications. Postpartum hemorrhage. Misoprostol is used for both prevention and treatment of severe bleeding after childbirth, particularly in settings where standard injectable medications like oxytocin are unavailable. Okay, so if the injectable oxytocin is not available, this misoprostol will greatly useful to prevent bleeding after birth or to control or for the treatment of postpartum hemorrhage. And cervical wrapping before gynecological procedure, it can be used to soften and dilate the cervix before surgical procedures like hysteroscopy, abortion, or insertion of intrauterine device. Contraindications. General instruction: in case of pregnancy, misoprostol is known to induce labor and cause uterine contraction. When used to prevent stomach ulcer in pregnant women, it can cause miscarriage, premature birth, uterine rupture, birth defects. For this reason, anyone with potential to become pregnant should have a negative pregnancy test before starting the treatment for ulcers and use effective contraception during the treatment. Hypersensitivity: anyone with a known allergy to misoprostol or the other prostaglandins should not use the medications. Contraindications for NSAID induced ulcer prevention. In case of pregnancy and childbirth, due to the risk of potential rupture, uterine rupture and abortion or congenital effects, misoprostol should not be used for ulcer prevention in women who has peptic ulcers. Inflammatory bowel diseases. Because misoprostol can cause or worsen diarrhea, it is generally not recommended for people with inflammatory bowel diseases and other intestinal problems. In case contraindications for labor induction, trial of labor after cesarean, that is TOLAC, TOLAC, trial of labor after cesarean. Using misoprostol for induction is contraindicated for women who have had a previous cesarean section due to the risk of uterine rupture. History of myometrial surgery. This includes women who have had any full thickness myometrial surgery such as myomectomy for the removal of fibroid from uterine wall or open fetal surgery. High parity. Misoprostol is contraindicated for women with a history of 5 or more pregnancies resulting in live birth. Contraindications to vaginal delivery. If there is any medical reason to avoid a vaginal birth, then we have to avoid misoprostol. Contraindications for medical abortion. Suspected ectopic pregnancy, long-term systemic corticosteroids, chronic adrenal failure, non-clotting disorders or anticoagulant therapy, presence of IUD, and inherited porphyria. So all these are some of the contraindications for misoprostol in case of gastrointestinal, in case of obstetrics and gynecological conditions. Precautions: to minimize side effects, misoprostol should be taken with food, especially to reduce diarrhea. Women of childbearing potential using the drug for non-pregnancy purpose must have a negative pregnancy test. Breastfeeding mothers should be aware that misoprostol process through breast milk. and may cause diarrhea in the infant. Okay, although levels become undetectable quickly. Side effects: gastrointestinal issues are diarrhea, stomach pain, cramping, nausea, stomach upset, gas, bloating, and indigestion. Reproductive system: uterine cramping, contractions, abnormal and heavy menstrual bleeding. Other common side effects are headache, dizziness, fever, and chills. Adverse effects. Adverse effects. Some of the adverse effects are uterine rupture, severe bleeding, severe allergic reaction, serious infection, cardiovascular events, gastrointestinal bleeding, and teratogenic effects. Uterine rupture. This is a rare but life-threatening complications, especially when misoprostol is used for labor induction in those with a history of cesarean delivery and other uterine surgery. Severe bleeding. Excessive vaginal bleeding that soaks more than 2 sanitary pads in an hour or for 2 or more consecutive hours may indicate hemorrhage. Severe allergic reaction. Symptoms can include hives, rash, itching, swelling of the face, lips, or tongue, and difficulty breathing. Serious infections. In rare cases, use of misoprostol can lead to toxic or septic shocks. Signs include high fever that lasts more than 24 hours after taking the medication, severe stomach pain, or feeling very unwell. Cardiovascular events are rare, but serious events include heart attack have been reported. Gastrointestinal bleeding. In rare cases, it can cause severe bleeding from the stomach or intestines with symptoms like vomiting blood or having black and tarry stools. Teratogenic effects. Misoprostol can cause congenital abnormalities in the first trimester, like skull defects, cranial nerve palsies, and limb defects. This is responsibility. Coming to the assessment, assess the maternal and the fetal status for the signs of distress or complications. Monitor for tachysystole. Watch for prolonged contractions that are too frequent, which can restrict the blood flow to the placenta. Monitor for side effects like abdomen pain, vomiting, severe cramping, unusual bleeding, or black and tarry stools. Perform sterile vaginal exams and assess the cervical dilatation, effacement, fetal station before medication administration. Verify the fetal position. Ensure the fetus is in vertex position using ultrasound. Patient education and support. You should get the informed consent from the mother. Explain about the risk, benefits, and alternatives before taking the misoprostol. Educate on the side effects like diarrhea, nausea, and flatulence. Instruction for the use. Advise the patient to report severe and unusual symptoms to avoid food that might cause stomach irritation. Post-administration positioning. Instruct the patient to remain in supine or lateral recumbent position for at least 1 hour after administration for cervical ripening. Administration and monitoring. Prepare supplies, gather gloves, lubricant, and misoprostol medication. Understand the protocols. Familiarize yourself with the established institutional protocols and guidelines for misoprostol use. For example, we saw that the dosage for labor induction is 25 micrograms every 3 to 6 hours. So, and as likewise, you have to understand the protocols for local protocols for misoprostol use. Continuous monitoring the patient for at least 30 minutes, every 30 minutes after misoprostol administration, and see for any episode of uterine hyperstimulation. And knowledge of contraindication should be there, and know when not to use misoprostol. Understand the contraindications like pelvic infections, sepsis, placenta previa, unfavorable fetal position, and other obstetric emergencies requiring surgeries. In this case, you are not supposed to use misoprostol. So I hope you got some knowledge regarding the drug misoprostol. We saw the name of the drug, dosage, route, frequency, and mechanism of actions, side effects, contraindications, indications, adverse effects, and complications. Thank you all.